everybody. In this lesson, we are going to be talking about fevers in our pediatric patients. And what we're going to do is we're going to look at common causes, what to include in your assessment, and then how we treat a fever. So let's just start by thinking about the big picture of what a fever actually is. So our clinical definition of a fever is anything greater than 38 degrees Celsius, or the Fahrenheit equivalent, which is 100.4 degrees Fahrenheit. And remember, fevers are a really, really important part of the body's immune response against infection. And it works by doing things like increasing the number of white blood cells and also increasing the production of antibodies. Now, most of the time, fevers in kids are actually caused by viral or bacterial infections. And you can see in this list here on the left some of the really common infections that we see in kids. The list I've included here on the right are actually some non-infectious causes of fever. And we're not going to go into detail about all of these different diagnoses that you see here. But what I want you to do is link what we talk about today about fevers here in this lesson with all these different topics that you see here. So we have lessons for you that go over the majority of these diagnoses. So check those out for more details. And then just remember to link that back to what you learned today about fevers. Our assessment of a fever really just starts with making sure that we get an accurate temperature. And most of the time, what you're going to be doing is taking axillary and tympanic temperatures for birth to 5 years old. And then from 5 years old, your older patients are going to be able to do an oral temperature quite easily. Just a quick note, always be cautious of taking a rectal temperature because there are a lot of contraindications for doing this that you need to consider. Our cheat sheet on VitalSign goes over all of the specifics on how to take a kid's temperature, so definitely take a look at that if you need a refresher on some of those specifics. So when a kid does have a fever, there are a couple of other symptoms that we would expect to see, and those are flushed skin, sweating, chills, malaise. They're just not going to feel right at all. They're probably also going to not be eating very much. So those are all important things that you would expect to see with a temperature. During your assessment, you also kind of want to be thinking about, are there any signs and symptoms of what's maybe causing this fever? So some really helpful cues or clues to think about for kids are things like, are they pulling at their ears? Do they have a productive cough? Is there a sign of a sore throat? And then some other really important things not to miss in this assessment would be things like signs of meningitis or rashes that could indicate a more serious infection. In addition to looking for what's maybe causing the fever, you also need to be on the lookout for complications. Now, the most common problem that we see associated with fevers in kids is dehydration. And we've done a whole lesson for you on dehydration, so take a look at that for more information on how you need to assess and then treat dehydration. The next complication I really want you to be aware of is called a febrile seizure. And these usually happen for kids ages 1 month to 6 years of age. And what happens is that when the temperature is going up really, really, really quickly, it can trigger a seizure in certain patients. And the important thing to know about these seizures is that they usually only last 5 minutes. And that even though they are completely terrifying for parents, they actually don't cause any long-term problems for kids. So that's really important to know and to educate parents on because it can be really scary. Our management of fevers is all about identifying a cause, providing fluids, and then giving medications to bring that temperature down if we need to. So the medications that we usually use for fever treatment are acetaminophen and ibuprofen. Acetaminophen can be used with any kid of any age, while ibuprofen can only be used from 6 months onward. Now, one thing to know is that we, in our pediatric patients, have 2 patient groups that we actually treat a little bit differently. So they're kind of exceptions for how we manage. And these 2 groups are infants who are less than 2 months old and neutropenic patients. So infants who are less than 2 months old are really, really difficult to evaluate. And they're also at a really increased risk for things like meningitis and UTIs. Now, if meningitis or UTI goes untreated, the child can end up with brain damage or even long-term kidney damage if it's a UTI. So because of these risks, kids under 2 years of age who have a fever are actually admitted for what we call a full septic workup. And this usually includes a lumbar puncture, a blood culture, a urine culture, and antibiotics. And I know that sounds like so much for these tiny babies to go through, but it's really important that we catch those serious infections and prevent long-term problems. Our neutropenic patients with fevers, we discussed that in great detail in our pediatric oncology basics lesson. So definitely take a look at that for a bit more information on how we manage their fevers. So like I said, most fevers in kids are self-limiting, which means they're going to go away on their own, and they're caused by viruses. So most of the time, fevers are managed at home. And because of this, it's super important that we educate families on how to take care of this. And there are a lot of myths out there about fevers, and parents actually really stress out and worry about them. And there's even a term for this, and it's called fever phobia. So just make sure that you have a chat with families and you figure out what's worrying them. And then also make sure they know about things like appropriate cooling measures and then how to administer medications properly. Just a quick note about administering medications. There is some debate on when and if these fevers should actually be treated. But the general consensus is that if a child is uncomfortable, give them some medication to bring that temperature down. And we can teach parents that they can alternate between acetaminophen and ibuprofen to make sure they're really addressing that discomfort. And then also make sure they know that they should never, ever, ever give aspirin to a child. And this is because it can cause something called Ray's syndrome. And Ray's syndrome causes brain damage. So we've got to make sure that parents know about that risk with aspirin. And we cover Ray's syndrome in the Neuro Med-Surg course. So check that out if you need a refresher on it. So when you're providing nursing care for a pediatric patient with a fever, your priority nursing concepts are going to be thermoregulation, infection control, and safety. Okay, so let's do a quick recap and highlight our most important things about pediatric fevers. So first, just know fevers are extremely common, and most of the time they're caused by viral infections that are going to go away on their own. Second, we have to know that our assessment of a child with fever depends on a couple of really important things. And those things are getting an accurate temperature, looking for a cause, and assessing their hydration status. Some complications to know that can occur with a fever are dehydration and febrile seizures. And our management is all about medicating and hydrating. So we're educating parents to make sure they know how to treat at home and give those fluids and medications that they need. And in the hospital setting, we have a couple of exceptions for treating fevers, and those are going to be infants who are less than 2 months old and our neutropenic patients. All right, that's it for our lesson on fever in pediatric patients. Make sure you check out all the resources that we have attached to this lesson, and also go look at those other lessons that I said will link into this. So lessons about UTI, meningitis, tonsillitis, epiglottitis, all those infectious problems that can cause fever. Check those out and link that information in with what we talked about today. Now, go out and be your best self today, guys. And as always, happy nursing.